Hey everyone, and welcome to The Explainer. Today, we're unpacking a really incredible journey, straight from a deeply moving first-hand account provided by Nurse Nova Academy. We're looking at a powerful, true transformation here. We're going to trace the path of a student who stepped into nursing school right after middle school, totally terrified, completely uncertain, and follow them all the way to becoming a confident, highly capable senior nurse. This isn't just a basic breakdown of a career path. It's honestly a masterclass in resilience, in overcoming that crushing weight of academic pressure, and finding this profound sense of awe in the science of the human body. So get ready, because we are going to break down exactly how an anxious beginner transforms into a medical professional who literally holds human lives in their hands. So, if you're a nursing student, or really if you're studying any demanding medical field, I want you to take a second and think back. Were you afraid on your first day? Did you feel just completely overwhelmed by the unknown, staring at textbooks that were thicker than bricks, listening to medical terminology that honestly sounded like a completely different language? Well, if you did, you need to know right now that your fear is incredibly valid. The source material we're analyzing today begins exactly there, with a student who freely admits to being terrified, filled with self-doubt, and just exhausted by sleepless nights. But as you'll see, that fear, it's really just the very first ingredient in a recipe for complete mastery. All right, Chapter 1, Overcoming Fear and Realizing Responsibility. Now, what's really interesting about this slide is what happens when a student first enters the hospital ward and the shock of reality sets in. Making a bed might initially seem like, a basic chore. But in nursing, there are absolutely no just chores. Think about it. A single, small wrinkle left in a bedsheet for a bedridden patient isn't just messy. It actually causes agonizing bed sores. It creates dangerous infections, and it actively delays healing. Suddenly, making a bed isn't housekeeping anymore. It is an absolutely vital act of medical care. This beautifully illustrates how, in this profession, true compassion and mercy are hidden inside the smallest, most precise details. As the student progresses, they encounter the absolute cornerstone of patient assessment. I want you to read this quote from the source. "A nurse measuring vital signs accurately may save a human life." Really let that sink in for a second. These aren't just arbitrary boxes to check off on a clipboard at the end of a long shift. This is the exact moment the student realizes the sheer weight of the responsibility they carry. They are literally the first line of defense between a patient and a total medical crisis. Let's see how this builds into an actual clinical superpower. Vital signs are, quite literally, the body's hidden language crying out for help. A spike in temperature, that's the body waving a giant red flag of infection. A sudden change in pulse uncovers invisible internal distress that you can't see from the outside. A drop in blood pressure isn't just a low number on a monitor, it's a physiological alarm bell demanding instant life-saving intervention. The student in our story realizes that mastering this language means they're no longer just observing a patient, they're actively deciphering the codes that keep them alive. Moving right along to Chapter 2, The Complexity of the Human Machine. So, this is where the training wheels completely come off, and the student steps into the incredibly intimidating world of medical surgical nursing, anatomy, and physiology. 100,000. That is the number of times a human heart beats every single day. As the students studied this fact, their academic terror actually began to shift into something entirely different. I mean, when you realize a muscle inside your chest contracts 100,000 times a day without you ever having to consciously think about it, the heavy burden of memorizing those massive textbooks transforms into a really profound sense of spiritual awe. The source material heavily emphasizes this shift in mindset, which is honestly absolutely crucial for building academic endurance. The overwhelming complexity of how the lungs breathe, how the kidneys tirelessly filter the blood, and how the nervous system orchestrates the whole shebang in perfect harmony, it led the student to a deep spiritual realization. The flawless, synchronized system of the human body became a powerful testament to divine creation. By framing their grueling anatomy studies not as a punishment, but as a journey to understand the greatness of the Creator, the student finally found the inner energy to push through the exhaustion. And, this realization expands outward into the cultural sciences, too. Suddenly, chemistry isn't just about balancing abstract equations on a whiteboard. It's understanding the complex chemical reactions keeping a patient alive second by second. Biology isn't just looking at boring charts. It's opening the door to the microscopic cellular worlds actively fighting off disease. Physics transforms from dry math into the vital mechanics of blood pressure, fluid dynamics in an IV drip, and the precise mechanics of human breath. The student recognizes that all science is just beautifully, perfectly interlocked. Which brings us to Chapter 3, the branches of care. As this student rotates through the specific branches of nursing care, all that academic theory suddenly gets a human face. And this brilliantly illustrates the immense emotional range a nurse has to develop. In pediatrics, the student learns that medicine alone isn't enough. Children require profound love and tenderness to heal. In OBGYN, they move from treating illness to the absolute miracle of witnessing new life entering the world. In psychiatry, they learn to treat what cannot be seen, discovering that sometimes a kind healing word is actually the most powerful medication for invisible pain. And over in community health, the perspective zooms way out, realizing that effective prevention can save thousands of lives before they ever even reach a hospital bed. With every single new specialty, the student's empathy and capability just dramatically expand. Now let's look at the timeline in Chapter 4, Mapping the Path to Mastery. For a student who is currently in the trenches, the finish line can feel impossibly far away. But the journey is structured. It begins with 3 relentless years in secondary nursing school, followed by 2 years in a technical health institute. Now here is where it gets really cool. The student notes that their immense hard work paid off when those institute years allowed for a direct bridge entry into the 2nd year of a nursing college. This is such a crucial reminder for anyone watching. The effort you put in now actually compounds. God rewards that hard work, and it builds bridges to higher opportunities. Then, after completing the college years, there's one final vital step, a rigorous 6-month internship. The internship is basically the crucible where all that academic theory transforms into vital, life-saving field experience. In this 6-month period, the training wheels are entirely removed. It is right here, standing over real patients, making real-time decisions, that the last remnants of the student's initial fear are finally burned away. They emerge on the other side, not as a student who merely passed a few written exams, but as a fully confident, capable, and responsible senior nurse. This leads us perfectly into our final section. Chapter 5, A Roadmap for the Next Generation. This source material doesn't just tell a success story, it pivots directly into mentorship for the next generation. Listen, if you are watching this and you are terrified of the complex English medical terminology, take a deep breath. Every single expert you look up to was once sitting exactly where you are. The key is to take practical action. Break down complex words into foundational root terms, use flashcards daily to build your vocabulary, and practice speaking the terminology out loud. Remember, struggling with this language barrier is a completely normal part of the process. It is definitely not a sign that you don't belong here. So the crucial point is exactly how you respond to that fear to build a strong and resilient mindset. Here is a clear, step-by-step roadmap drawn straight from the source. Step 1. Acknowledge the fear of the unknown. Don't hide from it. Face it. Step 2. Persist without surrendering to the pressure. Resilience is built in those exact moments you want to quit, but choose to study for just 1 more hour. Step 3. Maintain faith. Trust in God and trust that your continuous, exhausting effort is not going to be wasted. And finally, Step 4. Allow the process to transform you into that confident senior nurse. Remember, it's a marathon, not a sprint. And that brings us to the end of our explainer. The greatest professionals in the world all started with a single terrified step. You've seen the map, you understand the vital importance of the smallest details, and you know the rewards that are waiting at the very end. So I'll leave you with this. What will be your first small step today to conquer your studies, master your craft, and eventually tell your own success story to inspire the next generation of nurses tomorrow? Thank you so much for watching. Keep studying hard, and we will catch you in the next explainer.